Quality governance comes from a quality mindset. I want you guys to listen to Obaseki and be able to ascertain the quality of his mind. Governance not be cho. Governance now show workings, show doings. Quality is always better than quantity. Make una watch Obaseki. We will come talk.
I'm very disappointed. I mean, this hospital is less than 14 years old, and you can see clearly there's not been any serious work at maintenance. And with medical facilities, like most other public assets, if you don't maintain them, they'll fall apart. So I'm really shocked that if we had a facility like this, we didn't think of expanding it, of improving it, of upgrading it, and we started building something we call 5-star. I'm really shocked. I didn't realize that so much investment was poured here in the first place 12 years ago. Why we have not optimized them, I don't know. Look at the IC units that were just left to fallow. Today, they are unusable. I just spoken to management. We are looking at areas where there's duplication between this facility and General Hospital. You realize that most of the buildings in the General Hospital are very, very old. We're looking at consolidating the services provided in the General Hospital in this facility. So we'll pull down all of those old buildings and then get private investors to now come and invest in state-of-the-art, facilities, specialized facilities like oncology, like cardiology, things that, at this point in time, our budget may not be able to support. That's the point. That's what we're trying to get at, such that we begin to deal realistically with this challenge of medical tourism. Some of those facilities that people go and receive treatments in abroad, we want to encourage them to partner with them so that they can set up specialist care here and be able to show them and demonstrate to them that those facilities will be viable because we will have enough data of patients and conditions from the primary healthcare centers through the secondary centers. So with all of that data, they will be able to make informed decisions as to what extent of investments that needs to be put into healthcare. But underlining it all is that they now realize that, okay, if they have facilities here or we invest in these facilities, somebody will pay for it. That healthcare is not going to be funded primarily from state budgets alone. Right now, people are paying. The issue is what is the quality of the care they are paying for. In undertaking the reforms in our healthcare system, I don't know if you know, just as we've done in education, we have been looking at the total restructuring of the healthcare system. We have built 20 pilot PHCs, primary healthcare centers, and with those pilot centers, we want to expand to all the wards in the state very quickly. The whole idea is that the main care will be at the basic healthcare level. We need to have referral centers, referral hospitals, where patients who can be treated at the basic healthcare centers will now be moved to. And that has informed us looking at where secondary care, quality secondary care, can be offered to citizens. You also realize that we have one of the main issues that confront healthcare in this country is who pays. Up till now, there's been no comprehensive system where people save for their health needs. So we've introduced and passed it to law the Edo State Health Insurance Law, which makes it compulsory for every citizen in Edo to save towards their healthcare requirements, just like we've done in the case of pensions. But for healthcare, it's going to be everybody. Pensions is for those who are working in government institutions and parastatals. So with the plan in place, the challenge that that healthcare used to face in the past, which is not enough funding, enough capital to maintain infrastructure, to pay for quality human resources and human personnel, hopefully will be dealt with. And so for us as a government, you can't ask people to pay for this kind of quality of care. That's one reason why we're looking around to make sure that the basic healthcare centers provide quality care, and then the hospitals are referral centers. You can't come into a hospital like this in future to treat malaria or to treat basic illnesses. That should be taken care of at the primary level. So when you come in here, you're doing more, hopefully, diseases that cannot be dealt with at the primary care centers.
So my amazing Edo people, the purpose for this video is to show to you that your reality is directly proportional to your mindset. And how do you know the mindset of somebody is through the way they speak? And your mindset can greatly improve due to the level of education that you have. And the level of education that you have can greatly help in terms of governance. In this video, what was interesting for me was the words of Obaseki, not the infrastructure, the words of Obaseki. I brought out 5 critical points that Obaseki made out in this video. And one of those points is the health insurance law. He made it compulsory that you pay for your health. First and foremost, let me show you, this is my AOCA, my health insurance card. In Europe, I'm a foreigner. The moment I feel anything in my body, what I do, I first of all call my house doctor. Everybody in Germany have their house doctor. They go to their house doctor and explain to their house doctor, this is what I'm feeling. And if it is something he can treat, he treats it immediately. Just by slotting in this card, and he writes some tablets for me. I go to pharmacy, slot in this card, I get my medication without bringing out money from my pocket. Obaseki makes sure that there is health insurance in Edo State. Pay for your health. Health is not free. Health is very expensive. So he brought that because he is one person that have traveled around and he knows all what he has been experiencing all around abroad, wherever he has traveled to. This is how they operate everywhere in Europe. You pay for your health. If I tell you money only they pay for this, you will fear. This is my health insurance card here in Germany. So Obaseki talked about paying for your health insurance card. He brought it to life. And also he talks about referrals center, that their plan is to see how they can also build a referral center, which is they will build a primary health care and secondary health care. And the plan for Stella Obasanjo Hospital was to be a secondary health care, make it an health care hub, in the sense that when you have a critical illness, your primary health care will refer you from that place to maybe Stella Obasanjo Hospital for a proper treatment. You don't have fever or malaria, then you go to secondary health care like Stella Obasanjo Hospital and be treated. No, even in abroad, it's not done. If na headache I dey feel now, I'm not going to say because I dey feel headache, I get this my insurance card, I will just go secondary health care, which is big hospital. May they forgive me treatment. No. First and foremost, I will call my house doctor. I will go meet her. He now will write paper, slot everything inside this health insurance card. Then he will refer me from there to the big hospital when the matter pass their hand. Now, so it be. This was the mindset of Obaseki. Look at the statement of Obaseki. Obaseki said, we get something like Stella Obasanjo Hospital, will be say full space day. We leave that one, we abandon that one, going to build 5-star hospital. Why be say Stella Obasanjo Hospital is getting dilapidated all the time for eternal. That one another thing when they talk about. The Obaseki talked about the quality of healthcare people are paying for. He said he wants to make it very important that you get the best quality of healthcare that you are paying for. And that is how it is in Europe. The money wey they pay for my health insurance card, you go fear. But that is the reason also, when I go to any of their hospitals here, they don't treat me as if I'm a foreigner. They treat me as if I am a citizen of this nation, because I get what I pay for. That was the plan of Obaseki. In this video, Obaseki said, you don't expect people to get quality health care in that Stella Obasanjo hospital the way it is before, until its renovation of that place. That is because Obaseki don't travel. That is because Obaseki is educated. That is because Obaseki is advanced in his mindset. You see somebody mind? Not only that, Obaseki said, bringing what people go to enjoy abroad to Edo. As in, what people go to enjoy. You know, say, the tradition for our politicians now say, if they are sick, they quickly travel abroad to get treatment. The plan of Obaseki was to bring whatever they go to enjoy abroad, to bring it to Edo State. To bring it to, and if you go to Stella Obasanjo Hospital, that place is equipped with what class equipment? What class? What class? Whatever you go to enjoy in Europe, go to Stella Obasanjo Hospital. This one you can fast track me. Go to Stella Obasanjo Hospital. It is what class? What class? Taste. Go there. Bringing what people go to enjoy in Europe, bringing it to Edo State. This was the mindset of a man. It shows you how intellectual this man was. And the last point that he made was abandoning one project and starting another. Obaseki was so disappointed coming to Stella Obasanjo Hospital and met it in the state that he met it. And he made that statement. He said, how can you have such an hospital and you did not renovate it or even expand it, but you go to build a 5-star hospital? He's talking about Adam Saliu Oshomole. What has been the problem of governance in Edo State or even in Nigeria? Is it not when another administration comes, what the former administration have done, they abandon it and start their own, leaving the whole infrastructure to get dilapidated? Then they will start their own building. Is it not what we have been getting? But Obaseki said, why will you have something like this Stella Obasanjo Hospital? You abandon it in this state and you went to go and build a 5-star hospital. What happened to this one? Is it not the problem we are facing? In the Okpebolo administration right now, in the Okpebolo administration, what are we experiencing? Is it not all the project that Obaseki has done has been abandoned and he's starting his own project? What a shame. And we say with the progress, will they go backward? Now, let me give you another example. You will see from this my video, from the beginning of the video, you see all the files when they still at Obasanjo Hospital, all the files, paper, those are people file. People, health matter, their file, let be that. But during the time of Obaseki made sure anything that has to do with file was pushed out and he made it digital. But do you know that even the Edo State digital base, I know that digital base they call it, it's not functioning. Carry us back to paper. What a shame. Obaseki they carry like come up for light. When I say no, I will sink inside darkness. You know, one thing about is that, or one thing about light and darkness is that when you stay too long inside darkness, you can't begin to see inside darkness. Just try what I talk. So off all your light inside your room, make the room dark. At some point, you're not going to see. But if you stay too long inside that darkness, you'll call the see road. You'll call the know where your door day. You'll call the know where that one day. You'll feel call the move inside that darkness. That is the problem of Edo State. Is the big problem of Edo State. We have stayed too long inside darkness. We don't even want to come out from the darkness. When they use politics, they do everything. Obaseki, God will bless you. See quality of work now. See quality. And this quality of work is as a result of the quality of his mindset. So the quality of your mind is directly proportional to the quality of your reality. God bless Edo State. Share this video, like this video, comment on this video, and also don't fail to subscribe to this page. Thank you.